3, 2, 1.
All right, Margaret, let's see how you're walking today. Okay, we're going to keep going all the way into the middle of the parallel bars. Okay.
Margaret ambulates with a quad cane in her left hand. Her left lower extremity and upper extremity bear the majority of her weight overall, causing her left lower extremity to have increased time in stance phase. Focusing on her hemiparetic side, Margaret's upper extremity is positioned at her side in what appears to be a flexion synergy. Her lower extremity appears weak, but no synergy pattern is apparent. She lacks hip extension, terminal knee extension, and dorsiflexion. These are our primary concerns during this visit, as they are her most notable deficits at this time.
All right, so let's stick your paint on the outside of the parallel bars here. You can use the parallel bars. Okay, big grab for this part too.
According to Mohapatra, asymmetry in standing and during functional movements is common in patients with following a stroke. After 2 weeks of forced weight shifting onto the hemiparetic leg, patients demonstrated increased weight bearing on the hemiparetic leg as well as increased gait velocity, which led to more symmetrical gait patterns. This exercise is good for Margaret to emphasize equal weight shifting on each of her legs during ambulation. An added bonus of this particular exercise is to allow her hemiparetic lower extremity to get used to what heel off should feel like again once her dorsiflexors are strengthened.
Good. All right, you see that step? What I want you to do is put your left foot over the step, and you're just going to straddle. Good. Okay. What I want, when I saw when you were walking, this hip doesn't like to go back very far. Did you feel that at all? No? Okay, we're going to work on that. So what I want you to do is shift your weight towards this foot in front, and then shift your weight back towards your back foot. Good. And while you do that, try to look up nice and tall and stand up straight. Good. Let's try this a few more times. How's that feel? Good. One more. Good. All right, now take this step up. And let's walk to the end of the parallel bars.
The next exercise I want Margaret to perform is backwards walking within the parallel bars. Yang et al. Studied 25 patients status post-stroke who were able to walk with an assistive device or independently. In one group, patients walked backwards 30 minutes longer than the control group for 3 times a week for 3 weeks. Results indicated that walking speed, stride length, and symmetry were all increased in the experimental group following treatment. This indicates that asymmetrical gait patterns can directly benefit from receiving backward walking therapy.
All right, let's actually stay where you are. Don't turn around. We're going to practice walking backwards. Okay? So just try to take really nice long steps with both your legs and use your arms to point each other. But stay up and be nice and tall.
You will notice that Margaret is still not extending her hip as I wanted to gain from this exercise. To address this, I add some facilitation to her hamstrings to gain more hip extension. It is common to use multiple techniques within one exercise in order to get the results you intended to get.
Bring this leg back a little further next time. Bring this leg back. Bring it back, back, back. Good. One more step. Bring it back, bring it back, bring it back. Good. Let's turn around. Let's try that again.
As you will see next, I end the treatment session with skater's waltz for several reasons. This technique works to continue to break her upper extremity out of its flexion synergy, as well as allow more of an upright trunk during ambulation. I also wanted to end my session with Margaret with this exercise because it allows her to perform ambulation as a whole after we had practiced several parts of ambulation independently.